According to the National Sleep Foundation, most American adults don't get the recommended amount of sleep for good health and safety. Here are the most frequently asked questions about sleep disorders. What exactly is a sleep disorder?
A sleep disorder is anything that disrupts sleep. Individuals that suffer from sleep disorders cannot get a full night of restorative sleep that is so needed for our bodies.
Can snoring be a sign that someone may have a sleep disorder?
Yes, snoring can be indicative of a disorder called obstructive sleep apnea. It doesn't mean that they have obstructive sleep apnea, but it is a nice indicator that those people should at least be screened.
And what are some other signs that people should look out for when it comes to sleep disorders?
The biggest problems that we see in our sleep centers for Norton Healthcare are excessive daytime sleepiness and fatigue.
Can sleep apnea disturb other areas of a person's health?
For individuals that suffer with obstructive sleep apnea, for example, they're at an increased risk for heart disease and stroke. Individuals that suffer with diabetes, for example, that suffer with undiagnosed obstructive sleep apnea, they have difficulties regulating their glucose levels. So it affects all aspects of our health.
What is narcolepsy?
Narcolepsy is a neurological condition that really just individuals suffer with sleepiness, excessive sleepiness for no apparent reason, even though they're getting a full night of sleep.
And insomnia, I know, is a pretty big one. How does that usually affect sleep?
Insomnia is the #1 seen diagnosis by individuals. Everyone suffers with insomnia in some form or another. Insomnia is broken up into acute insomnia as well as chronic insomnia. Acute insomnia is nothing more than you wake up in the middle of the night and just can't get back to sleep. And intermittently, it's not really a significant problem. But if it turns into a chronic problem, it can be very disruptive and be detrimental to your health as well as your well-being.
What are some other conditions that are treated at the sleep centers?
Restless leg syndrome is a condition that we see periodically in the sleep center, where individuals feel basically a creepy crawly feeling on their legs, much like when your leg falls to sleep, goes to sleep, if you will. And the only thing that makes it feel better or makes that sensation subside is to get up and walk and move your leg, which keeps you from going to sleep. So by the time you're relaxed again and you get to the point where you're about ready to go to sleep, your leg starts doing that again, or your limbs start acting funny and you need to move them again.
What is a circadian rhythm disorder?
Really similar to like a work shift disorder. It's your circadian rhythm is completely disrupted due to events outside of your control. For individuals that work third shift, for example, have a very difficult time maintaining a normal sleep-awake balance, and so they suffer.
Now, I know that all these conditions are treated differently, but what would someone need to do if they think they do have a sleep disorder?
The first thing to do is to see a sleep physician. All of our physicians here at the Norton Sleep Centers are board certified in sleep medicine, and we have sleep clinics at both of our locations, at Audubon Hospital as well as Brownsboro Hospital.